All right, since we're all lining up to get the vaccine, hopefully enthusiastically, you want to know what the side effects are going to look like and what the safety signal is going to look like. And I should begin probably by saying that I've pored over this data a lot, and I can't wait to get my vaccine. So it's important to realize that there's only 5 months of follow-up in the group with the longest follow-up from July 27th to November 14th. But most people have about 2 months of follow-up. There will be more data coming out with 6-month follow-up and 2-year follow-up. And there's a number of other surveillance systems I'll touch on at the end. Overall, about 82% of people complained for either the first or second dose of some local reaction. After the first dose, it was about 50% had mild pain, and about 30% ranked their pain as moderate. Redness and swelling were less. I did look up the data for Shingrix for comparison if you've given or had that vaccine, and the local reactions are substantially higher for Shingrix, so it gives you something to use as a benchmark. Overall, about 72% of people at some point reported some systemic side effect from the vaccine. But let me show you more detail here. Just to orient you, the top are the vaccine recipients, the bottom are the placebo recipients. In each bar, there are two bars, one for the younger folks who are under 55 and one for those 55 and older. And you can see that after dose one, about half of the people reported fatigue in the younger age group, 34% in the older age group, and fever was seen in under 4% in the young ones and 1.4% in the silver fox and mature crowd. It's important to note that the placebo recipients had a lot of fatigue, a lot of headache, a lot of chills, and equal amounts of diarrhea. I think the fatigue just reflects 2020, and anybody who wasn't reporting fatigue was probably not filling out the form correctly. This is important though. This is the second dose, and side effects go up with the second dose. Now, fever is reported in 16% of the younger group and 11% of the older group. I'll show you more details in a second. Fatigue in 60% and 50% respectively, and there's more headache. There is more myalgia and arthralgia. Most in green are mild or moderate. You'll see a little bit of the gray stripe, which is severe, but remember that severe is defined as being bad enough to cause you to change your activity. So it doesn't necessarily mean it was very severe, but it meant that people took a day off from exercise or from work or avoided other activities. The side effects mostly occur in the first 24 hours or so after vaccine, usually the day after vaccination, as shown here on day 2. They tend to last 24 to 48 hours. It's important to anticipate that people will have some side effects. Tylenol can be used to blunt the side effects, but prophylactic use is not recommended. And here in more detail are the fever data, because I think this is helpful in thinking about how we're going to distinguish somebody who we think might have COVID-19 or another illness versus a vaccine side effect. You can see that although 16% of the young people had a fever of greater than 38, that about 2/3 of them had a fever that was only 38.0 to 38.4, so quite low grade, and about 6% had higher fevers. This is after dose 2, the more reactogenic dose. And for people in the older age group, only 3% had fevers that exceeded 38.4. And there are the fatigue numbers again. So that's side effects. Now I want to talk about what are potentially serious safety signals, and there really were none so far. Serious adverse events include anything that results in hospitalization or death. There were 8 in the vaccine recipients. Actually, most of those were appendicitis, and 4 in the placebo recipients. There were 2 deaths in the vaccine group and 4 in the placebo recipients, all thought to be not associated. The one thing that did crop up was, as a statistically significant spontaneous reported issue, was lymphadenopathy in 64 patients. That makes sense and was felt to be totally plausible. There were 4 cases of Bell's palsy in the vaccine recipients, none in the placebo group, but 4 cases among 22,000 people was felt to be within the background rate. So at this point, we can't make any conclusions about whether there's a causal relationship or not. Women who were pregnant were excluded from the study, so we have very limited data on pregnancy. There were 23 pregnancies diagnosed after the receipt of vaccine, and there were no serious pregnancy outcomes in the vaccine recipients, and in the placebo group, there was 1 spontaneous abortion and 1 retained products of conception. So we really can't say much about the safety, and I will come back to what we can tell pregnant women in the next slide. But the one thing that cropped up immediately after the vaccine was used in Great Britain was this case report of 2 people who developed anaphylactic or anaphylactoid reactions. They were healthcare workers. They both had a history of severe anaphylaxis. They carried epinephrine injectors with them. And we don't know what they were responding to at this point. There had been no severe cases of anaphylaxis during the trial. So how are we going to handle this? The FDA issued a warning that said do not use for patients with a history of anaphylaxis to any of the vaccine ingredients. And those are listed, you can look them up. ACIP went a little bit further and said anaphylaxis to any other vaccine or injectable product is a precaution, not a contraindication. And these people should be kept in the area where do the vaccination for 30 minutes and observed, and you should have the ability to start treatment for anaphylaxis at a vaccine site. So here's some other key recommendations that ACIP put out. And ACIP gives us sort of our practical, how do we use vaccines advice. So in terms of people with prior documented infection, they say that we should not be doing serologic testing for the purpose of making vaccine-related decisions. And current evidence suggests that reinfection is uncommon in the 90 days after initial infection. Persons with a documented acute infection in the preceding 90 days may choose to defer vaccination until the end of this period. People who have acute COVID-19 can be vaccinated once they're out of quarantine, so after 10 or 20 days, depending on severity. Pregnancy and breastfeeding are obviously of great concern since many of our care providers are pregnant or trying to get pregnant. And I think in a very enlightened way, the recommendation was much more progressive. In the past, we've often said, we don't have any data, so you can't have it as a pregnant person. But instead, the recommendation is that we provide the information that we really have no data on the safety of COVID-19 vaccines in pregnant women. But if a woman is a part of a group who is recommended to receive COVID-19 vaccine, she may choose to be vaccinated after weighing the risks of COVID-19, which has known risks that are increased in pregnancy, and the risks of the vaccine, which are unknown. What we can say is that no other vaccine has been demonstrated to be unsafe for pregnant women, with the possible exception of live vaccines, which we carefully avoid. But there is a theoretical concern about high fever in the first trimester. Well, we don't know what we don't know about long-term safety. 44,000 patients is not enough to find a 1 in a million side effect, of course. So there are really extensive systems that were developed in 2009 for swine flu that have been adapted to and expanded to give us a really good ability to pick up any safety signals that exist. We divide this into 2 systems. One are those that are looking for signal detection. So any report of an event that might possibly have a temporal association with the vaccine, and then what are called signal assessment studies, where controls can be used. So you can actually start to decide whether or not there is reason to believe that there's a causal relationship. And I won't go through all of these, except for one that you can see in pink on the near the center of the slide called the VSafe system, because we're all going to be invited to participate. This is a text-based reporting system for early side effects as well as for possible serious adverse events that you can sign up for. There will be, you'll receive information about it. You can scan the QR code with your phone and sign up, and then you get a text-based request to report on your side effects for the first week. and then a check-in at different intervals to see if there's anything more severe.